So hello everyone, I hope I'm audible and visible. Can you all give me a quick thumbs up if my audio video is fine? Everybody can give me a quick thumbs up if my audio video is fine, all of you. Okay. So Shrishti and Rafia, everybody is welcome in this session of dermatology with me. Now let us begin with today's session by a little bit of introduction. I'm Dr. Chesta Agarwal, your NEET PG educator on the best online platform, that is Unacademy. Now on Unacademy we have a few important notices, and so on Unacademy we are launching up with a Republic Day special offer, where if you get Unacademy subscription for 1 year and longer, you will have an amazing price of like if you buy a 1 month subscription, the 6th month is absolutely free. So I request all of you to please kindly use my code CHESTA10 and get your Unacademy 1 year subscription today. You can use this code CHESTA10 to get additional 10% discount as well as for getting the 6 month free. This offer lasts only for 3 days. So I request all of you that it begins today and it ends on 27th. Please utilize this benefit to have your Unacademy subscription today. Now we have a free live test calendar for the month of January and the paid subscriptions. We have plus classes which give you an access to Unacademy live session, and we have Iconic which give you an access to both Unacademy and Prep Ladder. We have a lot of free special classes which is known as the special class. Thank you Shrishti, thanks for asking. I'm still having fever and a little bit of running nose. I think the rest everything is fine. So thanks for asking, and I request all of you to please take extra precautions because maybe the flu is spreading very rapidly, or even Omicron have the same symptoms. So everybody requested to take special precautions. We have a latest 25,000 plus updated questions on the platform. So you can use my code and download these or access these questions, very important. We have a feature which is known as raise a hand. So if you have any doubt, you can just raise your hand and ask your doubt. We have a focus FMG batch starting on 27th and a target NEET batch which is again starting on 27th. Requesting each and every one of you to kindly follow this. A 2-month subscription which is very much or a high demand subscription right now. So requesting all of you to please use my code CHESTA10 and get your subscription today. Now we have a case scenario based MCQ session discussion, and in addition I will be discussing some of the important MCQs. So this would be the first question. I request all of you to please take your time, read the question carefully because it's a little lengthy question, and try to solve. You have to tell me which among the following is the true option or correct. I request all of you to please kindly read the question carefully. A 2-week-old male newborn was brought to the pediatric unit for a new onset of multiple cutaneous erythematous annular lesion. So let us mark the important points. The important point is that we have a young infant, 2-year-old male. That is one very important point. Second is he presented with erythematous annular lesion over the face. It presents with erythematous annular lesion over the face or scalp. Okay. The next very important thing which this patient has or which you need to know in the history is mother had a history of spontaneous abortion in the past. Mother was tested positive for SLE 3 years ago. Okay, and he is on treatment. He denies any flare-up. So I think by looking at these features, we got a clue that we are dealing with a patient with neonatal LE. How many of you have understood this point? So we are dealing with a case of neonatal LE. Positive mother, there is a good chance of having this baby as neonatal LE. Neonatal LE babies have two features. One is congenital heart blocks and another is cutaneous lesions. These cutaneous lesions are seen in around 50% of the patients, not 90%. They resolve spontaneously without leaving any scar. So option number 2 is also wrong. And they are photo induced. So they have effect because of UV radiation. So they are photosensitive rash. The only correct statement is the most common finding is involvement of the lesions around the eyes. Okay. The correct answer of this question is option number 4, that the common site of these cutaneous rash is around the eyelid and this is known as a raccoon site. ठीक है? एग्जाम के लिए कौन सा सब्सक्रिप्शन ठीक रहेगा? प्लीज रिप्लाई. प्रेम, लाइक इफ यू आर प्रिपेयरिंग फॉर द USMLE in Unacademy, we do not give you any subscriptions with respect to the exam. We give you the subscription with respect to the duration. So depending upon, see, today, tomorrow and day after tomorrow, we are having a 6-month free offer. So if you buy a 1-year subscription, you will be given 6-month free. And if you use my code, that is CHESTA10, CHESTA10, you can get 10% additional discount on the subscription cost. So Prem, I would recommend you to take a 1-year subscription so that you can have, or you can avail a 6-month subscription free offer. Okay. So the correct answer of this particular question is option number 4. I hope everybody is clear with this. Can you all give me a thumbs up and tell me if there is any confusion? And Prem, I hope your doubt is also cleared. Moving to the next question, a next clinical case scenario based question. 59-year-old healthy male presented for an assessment of non-healing painful necrotic ulcers on the left leg. 2 weeks prior, he believed that he sustained a spider bite while moving in the lawn. Which of the following is the correct answer here? Anyone has any confusions related to subscriptions, please let me know. Unacademy gives you an access to all the courses, any educator, any number of times with the same code. So if you want to buy the subscription for USMLE also, you can take it using the code CHESTA10, that is CHESTA10. Very nice, Shrishti. Now here we have a painful necrotic ulcer which you need to know. So let me highlight the important point. We have a 59-year-old healthy male who presents with painful necrotic ulcer and histopathology shows neutrophilic infiltrate. All these features give you an idea that you are dealing with the patient of pyoderma gangrenosum. Okay, so please remember the correct answer of this question is pyoderma gangrenosum. Pyoderma gangrenosum. What is pyoderma gangrenosum? It is a neutrophilic dermatosis. Neutrophilic dermatosis. Now in neutrophilic dermatosis, what happens? Because of neutrophilic infiltration into the dermis or into the epidermis, there is rapidly progressing painful ulcer. A very important feature is you do not need to give any antibiotics because it is a sterile ulcer. You need to treat them according to the inflammatory approach, that is you have to start the patient on oral steroids with or without Depsol. So this is a very classical case of neutrophilic dermatosis. Can you tell me any other associated feature or most common associations with pyoderma gangrenosum? Anything related to the GI disorder or gut disorder? They have underlying inflammatory bowel disease. They have an underlying inflammatory bowel disease, that is ulcerative bowel disease. Ulcerative colitis is a very frequent association with these conditions. Very nice. Next question. There was a 29-year-old young female presenting with recurrent oral genital ulcer. Very nice, Shrishti. Again requesting Shrishti and other students, please take a 2-month Unacademy subscription if you are targeting NEET PG 2022, as all the educators here are giving these high important or high yield MCQs. The session will start on 27th, where all the 19 subjects will be covered with respect to their important topics and important MCQs. So 2-month subscription is a very important subscription, right? What is the answer to this question? Very nice. Here the answer of the question is option number 1. Presence of orogenital aphthous ulcer. In addition to this, there is involvement of the eyes in the form of iridocyclitis. This is a very important feature of Behçet's disease, which is again neutrophilic dermatosis. How does it present? It presents with orogenital aphthous ulcer. Next important feature is involvement of joints, involvement of eyes. And in the skin, you tend to develop furuncle-like lesions, furunculosis. Furuncle-like lesions are very, very commonly seen on the skin. Next question. Anyone can tell me the answer here? Very nice, Shrishti. A 14.5-year-old girl with a history of weight loss, photosensitivity, vivacious rash on her upper eyelid. About 6 months ago, she had no complaints of fever, weakness, myalgia, arthralgia. On physical examination, malar rashes on her cheek were noted, connecting together on the nose. Erythematous papular lesions were seen on her anterior and the posterior chest, anterior and the posterior neck. She shows vivacious papules on the interphalangeal joint and extensor aspect of the forearm. Nail fold shows periungual erythema and proximal and distal muscle weakness of the limbs were noted. No muscle tenderness was seen. This is a case of dermatomyositis. Now in dermatomyositis, you see proximal muscle weakness. You see proximal muscle weakness. Okay, this is very important. Proximal muscle weakness. Second very important thing is you see a lot of cutaneous features and many of them has been described. You see a typical rash around the eyes known as heliotrope rash. Typical rash around the eyes known as heliotrope rash. Over the knuckles you see Gotron's papule, that is an erythematous papules and plaque. Gotron's papule over the knuckle. What else do you see? You see shawl sign on the V area of the neck or on the upper chest. What else you see? Mechanic hands. And you can even see periungual erythema or telangiectasia because of dilated blood vessels. All these features are secondary to dermatomyositis. Next question. Very nice, Mukef. Very nice, Shrishti. Amazing, all of you. So here there is a very important feature which is given is that the patient has features affecting hair, nails, as well as you have skin which is getting affected in addition to that of the sweat glands. All these three structures are ectodermally derived tissues. So all of these are ectodermally derived tissues, and that is why it is considered to be an ectodermal dysplasia. Ectodermal dysplasia. This is considered to be ectodermal dysplasia. Now in ectodermal dysplasia, we have mainly grouped it under two categories, where there is normal sweat glands function, and another is where the function of sweat gland is reduced. Sweat gland function reduced. Function is reduced. The example of normal sweat gland is Clauston syndrome, while decreased sweat gland is Christ-Simon-Toren. Now this question says that there is no hyperhidrosis, means sweat glands are normal. And if sweat glands are normal, it has to be option number 2. Is this clear to all of you? Mukef, Shrishti, all of you? So the correct answer of this question is option number 2. Ectodermal dysplasias, you have to look whether you have the features associated with hair, nail, skin, teeth. Okay. Next question. "36-year-old female with itchy rash over the extensors of the forearm of 1 month duration. She gave a history of photosensitivity. What could be the likely diagnosis?" Anyone can tell me the answer here in this question? "36-year-old female presented with itchy rash over the extensors of the forearm of 1 month duration." Yes, you are absolutely right, Mukef. I'm having sore throat and fever, so not able to speak a lot, but anyway I'll try to teach very slowly today. So a 36-year-old female with itchy rash on the extensors, and if you look at the lesions, they are mainly on the extensor aspect or exposed, photo exposed areas. So these photo exposed regions are actually related to photodermatitis. Okay, so this is a patient with photodermatitis. Next question. 45-year-old alcoholic male presented with erythematous to hyperpigmented scaly plaques over bilateral hand and feet of 3-week duration. There was a clear demarcation between the involved and the uninvolved skin. What will be the likely diagnosis? The options which we have is pellagra, contact dermatitis, atopic dermatitis, and seborrheic dermatitis. What is your answer? Anyone? Now let me mark the important points so that you can answer this. Alcoholic male. So what happens when somebody consumes alcohol? They do not take a proper diet, and they usually develops dietary deficiencies of important components like vitamin B3, vitamin B2, B12, etc. So this is one very important feature. Second is you have presentation of the lesions with clear demarcation, and the next is they are mainly present on the exposed part, that is hand and feet. All these features points towards the diagnosis of pellagra. In pellagra, which is a vitamin B3 or niacin deficiency, what you see? 4 Ds. There is photodermatitis, there is diarrhea, and there is dementia. If it is not taken care, we can develop one more D, and what is that one more D? They will die. So dermatitis, diarrhea, dementia, and death. The dermatitis is classically photodermatitis, where the Involved and the uninvolved skin has a clear demarcation between them. Very nice, Shrishti. You can develop scrotal edema, you can develop the sebaceous dermatitis like pelagroid nose features. We can have intestinal features of abdominal pain, crampy lesions, and even the diarrhea and central nervous system, which includes dementia. Next question. A 70-year-old female with pruritic eruptions on a lower abdomen and thigh since 10 days. On examination, there are intense bulla on the erythematous base. Nikolsky sign negative, oral erosions negative, and biopsy reveals subepidermal blisters with inflammatory infiltrate. What is your answer? This is also something which we have already discussed, so I want everyone to tell me the important point. What are the important point here which helps you making the diagnosis? Very nice, Shrishti. What about you, Mukif? And what about the other students? Only 1 or 2 students, they are participating in diagnosing. What about the other students? I request all of you to please answer. So look at the important points in the question. Elderly patient, so 70-year-old patient, you have itching with tense bulla and the surrounding lesion is erythematous. We have negative subepidermal, we have negative Nikolsky sign, oral erosions are also not seen. We have subepidermal blisters, and these subepidermal blisters have inflammatory infiltrate which includes eosinophil. All these features points towards the diagnosis of what? Bullous pemphigoid. Please remember this point, very very important. Elderly patient, tense bulla with associated itching, urticarial surrounding, subepidermal blister, and in this blister if you see eosinophils, all these points towards bullous pemphigoid. Is this clear to all of you? Can you all give me a quick thumbs up if this question is clear? Amazing. Which of the following statement about oral lichen planus is false? Which of the following statement about oral lichen planus is false? Very nice. Now, oral lichen planus is the most common autoimmune condition of the oral cavity. This is a true statement. Dental amalgam is the causative factor or predisposing factor, again true. Reticulate pattern is most common. Please remember, you can see development of malignant transformation also. And what variety of lichen planus develop malignant transformation? It is the erosive LP. Erosive type of oral lichen planus can have malignant transformation. So, clear? Next question. Tell me the answer of the next question. Please tell me the correct answer. In which disease do you most commonly see these hypopigmentary lesions? Very nice, Sakshi and Mukaf. These are nothing but the ash leaf spot, and we all know that ash leaf spot is a feature of tuberous sclerosis. Can you tell me what are the other features which you see other than these on the skin? We have a lot of features like shagreen patch. What else? What else do you see? We see shagreen patch, we see Conan's tumor, which are the hematomatous tumor of the nail fold. What else? We see shagreen patch on the lower back, and there is adenoma sebaceum, which is angiofibromas. Adenoma sebaceum which are angiofibromas. Okay, very nice. Scarring alopecia is seen in. Where do you see scarring type of alopecia? Lichen planopilaris, lichen planopigmentosus, lichen planus pemphigoides, or actinic LP. Where do you see scarring alopecia? Very nice. The correct answer is lichen planopilaris. In LPP, we have scarring type of alopecia, which is known as footprint in snow appearance. Very nice. Footprint in snow appearance. And what is it called as? This is known as pseudopallid. This is known as pseudopallid. Clear? This is known as pseudopallid. Identify the false statement in the management of lichen planus. Identify the false statement in the management of lichen planus. Can you tell me the answer? What is the false statement in the management of lichen planus? Identify the false statement in the management of lichen planus. Very nice. The correct answer of this question is, please remember, the best way of managing the lichen planus is we have to give topical steroid. So this is the wrong statement. You can give retinoid, you can give intralesional. Systemic is usually not considered to be the treatment of choice. We consider the treatment of choice to be the topical therapy, not the systemic. So option number 1 is the incorrect statement. Option number 1 is the incorrect statement. Next question. The disease shown in the images is associated with. The disease is shown in the images. It is associated with thymoma, alopecia areata, myasthenia gravis, or all of the above. Very nice. The correct answer of this question is all of the above. The disease which is shown is lichen planus, and lichen planus have so many associations like hepatitis C virus, primary biliary cirrhosis, thymoma, alopecia areata, morphia, dermatomyositis, vitiligo, myasthenia gravis, diabetes mellitus, etc. So all these are the associations with lichen planus. Can you tell me the correct answer of the next question? Histopathological feature of lichen planus. Very nice. All of the above is again the correct answer for this question. So with this, we are done with this half an hour session. I'm very sorry, because of my throat I'm not able to continue the session ahead. So we will be discussing the remaining part in the evening session today. So I request all my dear students that please subscribe this YouTube channel, that is Let's Crack NEET PG, which gets a lot of discussions of the questions which are high probability questions for NEET PG. It is a completely free platform. For more such questions, you can download the Unacademy Learning app, use the code CHESTA10 and get your subscription. We also have a Telegram group which includes all these details. I request all of you to please press the bell icon so that you get all the notifications of my classes beforehand. And if you like my class, I request you to please give me a thumbs up and